Alright guys, I want to go over the nephron a little bit before we do any of the physiology. Now, the nephron is the functional unit of the kidney. So when we talk about the nephron, we need to remember the renal corpuscle. So first you have a blood vessel that enters into the nephron, and then this is going to basically twist and convolute, and then it's going to exit. So this right here is called your glomerulus. Your glomerulus is going to be a capillary bed where filtrate, which is going to be urine, is going to be produced. So the glomerulus is a special capillary bed that is attached to your afferent arteriole, which is always going to bring blood to the nephron, and then exiting, the blood is going to exit through the efferent arteriole. Now, to review on arterioles just a little bit, arterioles are tiny arteries. Arteries are basically going to have smooth muscle inside of them, which is going to be an important component of what we talk about today. So when we talk about efferent arteriole and afferent arteriole, these can vasoconstrict, which means get small, and they can vasodilate and get big, which is basically going to control the amount of filtrate that we produce at the renal corpuscle. Now, the renal corpuscle, when you say renal corpuscle, it includes the afferent arteriole, which leads up to the glomerulus, a special capillary bed. But on the outside, it's going to have a capsule, which is known as Bowman's capsule. So, Bowman's capsule, or the glomerular capsule, is going to make up the renal corpuscle. All of this is the renal corpuscle, and this is called the glomerular capsule, and it's also called Bowman's capsule. This is ultimately where we're going to filter the blood, and we are going to produce filtrate, which we're going to call urine eventually. So as blood enters into the afferent arteriole, I'm going to use black, it's going to go into the glomerulus. Now, some of your blood is going to be filtered out, it's going to be pushed out, that's called your filtrate, and then some of it is actually going to continue and it's going to exit and leave the efferent arteriole. So we're filtering our blood at the renal corpuscle, which includes the glomerular capsule and the glomerulus. Now, your filtrate, that's what's being produced, is going to be called your urine. Your filtrate has to have somewhere to go. So it's going to go into the renal tubule. So the first tubule that is attached to the renal corpuscle where the filtrate goes is called proximal convoluted tubule, or just proximal tubule. Convoluted means, or convoluted means that it's coiled. So your filtrate has to go into the renal tubule, and the one that's closest to the glomerulus is called your proximal convoluted tubule. Now, it's going to basically thin out, and it's going to dip down. So this is basically a portion or an attachment of the proximal convoluted tubule, and we call this the descending limb of the loop of Henle. So that filtrate is going to have to always go in this pathway. Now, your distal convoluted tubule is going to start right here with the ascending limb of the loop of Henle. So technically it's connected, but we call this the loop of Henle, so I'm just connecting it. And it's going to go into the distal convoluted tubule, and this is all part of your renal tubule. So we shouldn't pretty much label it. Okay, this right here is your PCT, this twisted thing. PCT stands for proximal convoluted tubule. So your filtrate is going to go into your proximal convoluted tubule. From there, it's going to go down, and this is going down, so the word for down is descending. So this is called your descending limb. Of the loop of Henle. That would be this structure. Then it goes through the loop of Henle, so we can literally label this the loop of Henle. And then it is going to travel up. It travels up through the ascending limb of the loop of Henle until it goes here into the distal convoluted tubule. So these are part of the renal tubules. So DCT is your distal convoluted tubule. Convoluted means it's twisted. Now that's going to be this whole anatomy is very important for the physiology. So we're going to be talking about filtration, which occurs here, but we're also going to talk about reabsorption, and we're going to talk about secretion. So we have a lot of things that has to happen. So you filter your blood, but you need to be able to reabsorb blood or some of the ingredients from your blood back into the bloodstream. That will be reabsorption. And then sometimes you're going to have waste that you need to get rid of last minute. So you're going to say that that is secretion. So you're going to secrete it or excrete it. So when we talk about nephron anatomy, the nephron is the functional unit. You need to understand the afferent and efferent arteriole because this is going to control how much urine you produced in different situations. We're going to talk a lot about vasoconstriction and vasodilation of either the afferent arteriole or the efferent arteriole in many cases. And when you talk about your filtrate, we're going to call this the glomerular filtration rate, your GFR. The filtrate is the blood that exits the glomerulus that's going to be filtered so that you can produce urine. So today's video is part of basically the afferent arteriole and the efferent arteriole and how we can control the kidney by changing the shape and size of the afferent and efferent arteriole based on different types of situations.